Hello, my name is Jenny and I'm a volunteer for Great Minds Together, offering peer-to-peer support for families with children of special educational needs and disabilities. I'm also one of the co-founders of Action for Send, which is a parental-led group. And again, we offer peer-to-peer support, guidance and signposts to the most appropriate services. I'm also a mum of two boys, 16 and 13. So we have two teenagers in house, which sometimes can be a little bit tricky at times. Joseph is 13 and he has autism with a dual diagnosis of a learning disability. My oldest child has specifically asked me not to talk about him on any media platform. You know, he's 16, it's his journey, so it's not for me to, you know, talk about, but he has given me permission to share some of the battles that we've had and some of the lessons that I've learned from helping him navigate the system. So there is that. I also used to be a TA working in a school, predominantly supporting children with SEND. I loved my job. However, I chose to leave that post in order to ensure Joseph receives specialist provision, and he is now in that specialist provision, so that was a good choice. But upon reflection, you know, I miss my job. I miss working with my colleagues. I miss having that time away from home. I miss the children that I used to support. I miss the contact, that face-to-face contact with my parents, and everything that comes with having a life outside of the home. So I miss that. And I do think really I shouldn't have had to leave my job, you know, something that I trained really hard for in order to get my son into specialist provision. So that's the impact. And I suppose one of the things that we're going to be talking today is impact, both from a mental health point of view and wider impacts. And that's definitely one of them for me. You know, I've had to leave my job. That is a consequence of me not being able to manage two full-time jobs, so that being a paid job, and my other job caring for my children, but also navigating the system at the same time, which is really, really difficult. So that's one of the things I'm going to be talking about. I'm also going to be talking about de-escalation, because with Joseph, there are so many wonderful things about Joseph. First of all, he's charismatic, he's funny, he's so sensitive. He has got a sense of humour, despite some of the things that I've read about autism, that, you know, children with autism don't have a sense of humour. Joseph does have a sense of humour. Yes, at times, you know, he can be literal and things can be black and white, but actually he does have a sense of humour and he is funny. So, you know, you can be both. That from our perspective, you know, children with autism, you know, can be very literal, but they can also be very funny with a great sense of humour. And Joseph's got a very sometimes dark sense of humour. So we can have both. And the autistic spectrum is so massive. And I think there's still a lot of misconceptions around what autism is, and it's only one thing, and it's so much more than that. And I know, you know, you and I, we all have our own personality, don't we? But we have things in common. And that's exactly the same for children with autism. I've worked with children that present very differently to my son. So, and that's actually okay. You know, it's good. It's a good thing. So, you know, going back to me having to leave my work, so that has affected my mental health. And I think when we look at mental health, sometimes we don't necessarily understand what it is to have good mental health and to be healthy. And that is the same for me as an adult, and for you and for children. You know, we all want the same things, whether we are neurodiverse, neurotypical. We all want the same things. We all want to be loved. We all want to fall in love. We all want to feel part of the community. We all want to feel accepted and to feel valued, to be liked, to be part of things, to be included, to be warm, to be clothed, to be fed. You know, they're the fundamental things, of course. You know, to be healthy, you need to be on a balanced diet, you need to have exercise, you need to have clothes, you need to, all those fundamental things. But actually, you also need to feel part of the community. You need to feel human, and to have a good, healthy, positive mindset means that you know what it is to be human, and they need to go hand in hand. So we'll be talking about that. So what has my role been as a parent in order for Joseph to feel human and to feel part of the community and to feel loved and feel accepted? That's a really tricky one, because it's not something that I can do in isolation. I need relationships with others beyond the home, including professionals, to be able to do that. I can't do that on my own because the world is much bigger than the house. Joseph would love just to stay at home. That is a negative consequence of how he perceives the world. The impact of that is he just wants to stay at home all day, because he's learned actually that home is a safe place. And sometimes beyond the home, sometimes life is difficult and tricky, and people don't understand him in his words. So that's been really hard to manage. So let's take it back. So my introduction to the world of SEND started when I had my first child, and very typical, actually. He presented very, very typical up until the age of, I would say, 4. And then he started to present with tics, very, very low level, very subtle. You really needed to watch him very, very carefully in order to notice them. And then it kind of escalated into a lot of habitual habits that he felt that he needed to do, that he couldn't help, and then escalated into quite large gross motor tics. And for me, it was always about, when this becomes a problem for him, when he becomes aware of it and it's becoming an irritant and it's impacting on his life, then that is when I kind of need to do something about it and need to look into things more, which is what I did. It wasn't as easy as what I thought it was going to be. Normally, you go to the doctors if you feel like you're not very well, you go to the doctor and the doctor gives you a prescription and off you go. It's not quite as simple as that for children with special educational needs. There's such a long process involved. So that's when I realised that actually this is going to be a bit of a battle. I'm not just going to be able to go to doctors, and he's not going to, he's not going to refer me on to who I need to see the relevant person. I'm going to have to prove this. I'm going to have to evidence it, and I need the school to work with me. So that was a long process, and I was very naive around that, and I didn't know anything about legal processes, and I didn't know anything about the SEND world, and I was very underconfident in terms of knowing myself and knowing the right questions to ask and questioning other professionals. And so that experience kind of prepared me for Joseph. And I must impart that my oldest son is doing really, really well. He's succeeding in his life. He's got a full-time job. So he is healthy, he's mentally healthy, and he is succeeding. So at the moment, at 16, he is exactly where I would want him to be. So that's really, really good. So his experience prepared me for Joseph. Joseph's experience. And what it taught me is that actually things aren't going to be given to me on a plate just because I say I'm concerned or I'm worried or I see things in the home. I'm going to have to really armor myself up with knowledge and be Joseph's advocate, be the person that is steering that ship, be the person that's in control. And so that taught me that, and that's what I did. So I was ready for when professionals didn't see it. And I just want to say something on that. That's not necessarily the fault of professionals either, because having worked in a school, you know, when you're in a classroom of 30 children, and you might have, I don't know, a group full of children that might present differently or not quite in line with the national guidelines. You've got 30 children to support. And as a TA, I didn't have any SEN training at all, nothing. However, what I did have was lived experience and 2 children at home that needed a lot of support that goes beyond the baseline parenting skills. And so I think I was tuned in to a lot of those children's needs and how to identify those needs because it was my life. So that did make it easier for me. However, in general, you know, TAs, they don't get the training that they need. And more often than not, you know, the week before they might say, you've got a child that presents with X, Y, and Z, you've got to give them one-to-one, you know, and that's sometimes how it happens. And so in terms of Joseph, I was ready. So I researched, I went and learned all about the SEN Code of Conduct, which is an incredibly important piece of work, but there's loads and loads and loads of it. So I just picked out what was relevant to me. That was really, really useful in terms of referencing. I researched lots and lots about autism. And again, going back to not all children present the same, but I wanted to learn about my child and how my child thought in terms of his brain being a neurodiverse compared to my brain being neurotypical. And I tried to step outside of the box and go beyond how I think and how I would process and how I perceive the world, because it's not how he does. And I think as a mainstream society, we expect children to conform and to see things and to react to things and to plan and prepare things the way we do as neurotypical people. And it's just not fair. We need to flip the narrative. And so, you know, as a parent, you think, well, I know everything there is to know about my child. Well, not necessarily when you have a child that is presenting very differently to other children. And so you have to go beyond the normal parental skill set. And so that is what I've had to do, first of all, and also get to know his triggers. So sometimes children with autism may present externally and have really big meltdowns. And sometimes it might appear like that meltdown has come from absolutely nowhere, but it never comes from nowhere. There's always lots of tiny incidences that might have led to that meltdown that you're not necessarily seeing. You're not seeing it, but they're happening. There's lots of things environmentally that are happening all the time around that child that you're not necessarily seeing, but they're feeling it. And so that's why you're getting the big meltdown. So it's about understanding those triggers. And so that's really, really helped me to de-escalate into a meltdown, to be able to understand him and to be able to avoid those triggers. Now, sometimes you can't avoid a meltdown. And sometimes I've learned that it's actually a healthy thing to allow that meltdown just to happen. You know, you've tried your best, You've tried to identify the triggers, but sometimes it doesn't matter. Sometimes actually a healthy thing is to allow that meltdown. If Joseph's in a safe environment and he needs to go into his bedroom and he's had a really tough day at school, and he needs to be able to express that externally, he's at home, that's a safe place to do it. So, my role as his parent is to facilitate that actually, and to provide that safe space for him to have that meltdown and to help him slowly come down in his own time when he's ready, and then let's talk about it. Okay, let's go through it. But it has to be something when he's ready. Because as parents, I think we want to, are you okay? Let's talk about it. Is there something else that I can, you're trying to talk them through that meltdown, and sometimes it works, but sometimes actually they just need to have a meltdown and get it all out. And then I've learned to allow Joseph just to come to me when he's ready and gain some of that control back, because when children are living in a world where they feel out of control, because sometimes they're expected to conform to the main, that in itself just brings a whole load of anxiety, and there is a lot of anxiety in terms of autism. My child's life is influenced by how anxious he is. And so I see a lot of demand avoidance behavior with him. And from my perspective, I interpret that as he's trying to gain control, because anxiety is around, for him, feeling out of control. And so he's trying to gain some of that control by avoiding what he sees as demands. So that's him trying to self-regulate. And as adults, sometimes this video, for example, I've had some anxiety around talking for 40 minutes, and there was a part of me where I tried to avoid it for a couple of days because it was a bit of a trigger. What if I say the wrong thing? Or, what if I let people down? So I avoid it, and that is around my anxiety. And it's the same for children in terms of masking as well. So when Joseph went to school, and sometimes in his new setting, he's in a specialist setting, sometimes there is still a certain amount of masking going on. But when he was in a mainstream setting, so Joseph went through primary school without being diagnosed, and this did lead into a massive escalation of a mental health crisis. We saw a lot of masking, and in fact, he was a professional masker, actually, as he tried to conform and not try and stand out. And again, children and young people with autism will present very differently. But for Joseph, he was a professional masker. And he was actually very aware that he was different and he saw the world differently, and others viewed him differently. And he was super aware of that, and very intuitive of people's feelings. And again, I've worked with children that are unaware of how children perceived them, who were very much in their own world. Joseph is actually the opposite. He was acutely aware of how others perceived him, and in turn just further led to how he felt about himself, really, to the detriment of his mental health. And Joseph would internalize at school, so he wasn't a chair thrower, he wasn't a shouter, and so he internalized how much he was struggling, and again, to the detriment of his mental health, because then what happens then is he comes home, he has the meltdown, and over a long period of time, this creates trauma and PTSD type symptoms. So actually, I would like to see more of a platform for children like Joseph, who internalizes, to feel safe in order to voice how much they're struggling. And that's a really tricky thing to do. with masking. So if the educational psychologist, for example, would come into the school, and Joseph's never met an educational psychologist, this is the first time, and they sit Joseph down and ask him how he's doing, and he will give a masked response, and he will say, I'm fine, I like it at school, I'm happy. And then that response is then transferred into a document, and it's there forever. And so, you know, in terms of Joseph protecting himself, masking was something that he did, but actually it didn't help him gain the support that he needed, because he did it very, very well. And so school would say he's fine, but actually he wasn't fine. And we saw that he wasn't fine in terms of the trauma, you know, a year, 2 years down the line. So when he came out of that environment and was placed into a specialist provision, and again, that came back from all of the groundwork that I did, learning the SEN code of conduct, working with professionals, knowing my rights, knowing how powerful my voice was, knowing how powerful my child's voice was. In the end, he did get placed into a specialist provision, but then the trauma comes, because he's out of the mainstream and he's into the right provision. But then we saw a lot of trauma, and that came from years of masking. So there's lots of things that I wish I'd have known in the beginning that could have prevented and de-escalated, and prevented to the point where we now have trauma that is external to the diagnosis. Joseph having trauma isn't anything to do with his autism. I want to make that really, really clear. And his PTSD type symptoms isn't anything to do with his autism. And actually, Joseph's autism, you know, adds to Joseph's personality. It's not a negative, it's a positive. But it's the external in terms of how he's been supported in the past and how he's been viewed in the past, and the narrative that people have used with him and with me in the past that has created the trauma and the PTSD type symptoms. And now the impact and the consequence of all those things that have gone before now is having to be re-referred back into CAMHS. So that's not counterproductive in terms of finances, really, because we know that CAMHS is really, really overstretched. So I want you to know that our process was really long and drawn out. And my first experience with my son did teach me lessons in terms of this time, know your rights, arm yourself up with knowledge. And that's what I did. So this time I did feel more in control. I didn't feel as if I didn't have a say. And I think part of that is around removing my fear. I removed my fear in terms of questioning. It's okay to question. You can do it in a respectful and politeful way. It's actually okay to reflect. And as a professional or you know, having worked in a TA, that is part of my reflective practice, you know, to be questioned, to have a bit of scrutiny. It's part of a job role, and actually it should be part of everybody's job role in all services across SEND, to welcome scrutiny. So that is something I definitely wish somebody would have told me at the beginning of my first child's process, that you have got the power. You can make a parental referral. That is in your power as a parent. You know, look at the Children and Families Act 2014, look at the Disability Discrimination Act, look at the Equality Act, you know, bring SENDIAT, look at SOSN or SOS SEN. There is information out there to be able to arm you with knowledge, and you do have rights, but never question yourself as a parent. listen to your gut, listen to your intuition. You are the expert of your child. And parenting, when you're parenting a child with additional needs, it is tricky because you're going beyond basic parenting skills all the time, and that is going to have an impact on your own mental health. And your mental health actually is the most important because you're steering the ship. You are your child's advocate, and that is something that I found really actually difficult to give myself that message, because I'm always supporting Joseph, and I've actually realized that that's not sustainable long term. If I have to keep him up here all the time in terms of his mental health, who's doing that for me? So I've had to be quite strict in terms of giving myself some self-care days and kind of trying to switch off from everything send, which is really hard when you've got lots of emails that you have to write and lots of telephone calls and lots of meetings to attend. But you must take good care of your own mental health, and I have to practice that every day, and that's more of a mindset, trying to look after myself, because this is a lifelong thing. You know, my son's going to need support forever, and everything I do is to get him ready to live independently of me and get him ready for when I'm not here. So we need to be looking at those wider outcomes as well. One of the things that has made it easier for me, going back to Joseph's autism and going back to the de-escalation and trying to prevent that mental health crisis, is really be very careful of the narrative that I'm using with him. And because everything I say, he sees as a demand. So teaching myself around the correct narrative to use when you're supporting your children that may be demand avoidant, and looking at how important the narrative is. And that is not only when you're supporting children, but when, as a parent, when I'm speaking to professionals as well, the narrative that you use when professionals are talking to me is so important. The communication is so important. And I know when I'm supporting a parent, the way I communicate with them is the first thing. That opening line is the first thing. And more often than not, even before we have that conversation, because I know what they're going through, I've been there, I am there already, I'm there still. I already have that narrative, I already have that understanding, I know what they're going through and I know how they're feeling, and that is massive. When you have that understanding there, you feel safe. And feeling safe actually is another fundamental factor when I'm supporting Joseph and when I'm communicating with other people. So any new people that I introduce to Joseph, the most important thing is that he feels safe with them and he's able to speak freely to them. And that's not going to happen in the first week, the second week, or even the third week. That's going to take a long time. But feeling safe is really, really important. And we all like to feel safe, don't we? We all like to trust. So I think that's enough for now. Thank you for joining me. Thank you for listening. And don't forget how powerful you are as a parent and how important you are in terms of supporting your child. And remember what a really, really, really good job that you are doing. Thank you.